Within the Department of Endocrinology in the Ochsner Health System exists the Frank Riddick Diabetes Institute, which is named after former CEO and former head of the endocrinology section, Dr. Frank Riddick Jr. And the goal of the Frank Riddick Diabetes Institute is to enhance the care for people with and at risk for diabetes and those who care about them, and also to innovate by helping to develop new therapies and healthcare delivery systems for people with diabetes, and also to educate both people with diabetes as well as healthcare professionals who take care of people with diabetes.
Ochsner Medical Center earned the certification from Joint Commission. It's the Inpatient Diabetes Management. It is a very unique certification. It is awarded to less than 1% of hospitals across the United States, so that accounts for a little less than 100 hospitals have actually earned this recognition. To me, it means good patient care. It is definitely a source of pride, not only for the providers, but also for the staff, the nursing staff. Everybody on our facility is trained in how to help manage diabetes.
So here at Ochsner, we've really had a big focus on providing education to our healthcare providers. We do several types of education. We do education for our endocrinology department. We also do education for our primary care providers, which also includes the primary care team. So we try to do team-based learning where we have several care team members do education.
The ADA education recognition that we've been able to maintain is important, not only just from a billing standpoint, but also from a national accreditation standpoint of quality. So we're following the latest 2017 standards of diabetes self-management education and support services, and we've been able to incorporate those same standards across our health system with probably, I guess, the total of about 15 sites in all.
Population health is going to be extremely important for team-based care. In our old care delivery model, it was usually you just see the physician, but when you're dealing with population health and panels of patients, you really have to work well as a team. So having diabetes educators, health coaches, pharmacists, the physicians, the advanced practice providers, all working together to coordinate services.
The digital medicine program really emerged as a new way of managing patients with chronic disease, recognizing that chronic disease are things that typically change on a regular basis. An episodic type of care model where we see you 2 or 3 or 4 times a year, we're not really catching all the information we need to. So how can we be digitally connected with our patients such that information appears to us as care teams real time, and we're able to intervene real time to keep people under control and out of the hospital. The OBAR is meant to be the digital interface between the care system, the delivery system like Ochsner, and our patients. So how do you get a connected device? How do you get it hooked up so that the information gets into your medical record system? How do you know which app's going to help you with your diabetes management in terms of accomplishing a goal? We have all that set up in a curated fashion on iPads, as well as a genius behind the bar that can help you, even if you're technologically challenged, with the entire operation of getting set up. It is pretty unique. As far as I know, we're the first to develop the concept. We've had people from around the country and actually around the world that have come to view this, and now they're incorporating OBARs in their own facilities across the globe.
In collaboration with the endocrine staff physicians and the support of the team, the nurse practitioners run a hospital hyperglycemic service. So not only for patients who are admitted with diabetes or uncontrolled diabetes, but patients who are also admitted and they suffer from high blood sugars. And so the unique role that the nurse practitioners can play is that we're able to round more often on patients. We have a close relationship with the staff nurses, and so we're able to be there with the patients. And we're also there as a resource for the nurses in case they have questions about complex insulin regimens.
Within the Frank Riddick Diabetes Institute is the Ochsner Diabetes Clinical Research Unit, which I have the privilege of directing. And over the last couple of decades, we have been involved with randomized controlled trials of new therapies for people with diabetes.
I think some of the excitement about the future is not only be able to do a better job at a lower cost in terms of managing large populations, but now we're able to start adding artificial intelligence into the equation. We're able to predict things long before things actually happen. So we can actually predict now with a lot of the data that's coming through who's going to fall out of control a month from now. I think there's a lot of opportunity in artificial intelligence to do these kind of things.
Well, part of any successful program is the idea of sustainability. And there has to be sustainability in the context of allowing for growth. So the model we put together, we really feel will be sustainable when we have a lower cost care model providing excellent care to the patients. So by having education be the main focus, by having our diabetes trained nurse practitioners in primary care, we really feel that it will be sustainable over time.